welcome back, everyone. I hope you've managed to get your biological break. The session we've got coming up then, and the conversation started a little bit in the first session, which is great. Sort of moves us into there. The thing that we've all been experiencing is COVID-19, and of course, it's had a particular impact on older men. Not only are older men most vulnerable to the physical health risks of COVID, but also all of the stuff around social isolation has a particular impact on older men. When you think about, we're all on Zoom, which is amazing, but how many older men are struggling to actually access conversation through Zoom and even telephone if you've got hearing issues. And so there are particular challenges about men and social isolation, older men and social isolation that we know have been coming up. But I'm not going to talk about that because the people we've got are all representing organizations that work directly with older men to share some of the experiences that they've been having, but also at the same time to actually just give us a flavor of the many different projects that are working with older men and what they're doing. And on our panel, we have Lindsay Oates from the Victorian Men's Sheds Association. We have Ken Young, who's from a Omni group, Older Men New Ideas discussion group in Victoria. We have Louise Adcock from Tomnet, the Older Men's Network in Toowoomba in Queensland. We have Chris McNamra from the Prostate Cancer Foundation of Australia. Good to see you, Chris. Last saw him around about this time last year when you've moved job. You moved job, haven't you? It's so wonderful to see that you've got another role. And we have James Wild of Men's Sheds WA. I'm going to have to chase and find out where he is. And also a late addition, because he wasn't sure whether he could make it, is Stuart Torrance from the Australian Men's Sheds Association, the health project officer there. So I'm going to start. We had an agreed order, Stuart. I'm just going to work out in the background where we drop you into the conversation. But I'm going to start with Lindsay, and I'm going to give you all about. I'm going to just have more of a sort of like give each speaker the mic for about 10 minutes here to tell us a bit about who they are, what their organisation is, but then specifically how the men and the men's projects they represent have been dealing with COVID-19. And I'll start with our radio man, because we can't see his face, but he's got a great face for radio is the joke, isn't it? He's got a great voice for us, and he was loud and clear. So Lindsay, I'm going to hand straight over to you, Lindsay Oates from the Victorian Men's Sheds Association. The floor and the microphone is yours, Lindsay.
Right, can you hear me? Thank you. Okay, thanks very much for the opportunity, and welcome everyone to this very important session. I really enjoyed the last session, and there's a lot there that is happening, and it's great to hear what other people are doing and what sheds are doing around Australia. In Victoria, there are about 325 sheds, and across the state, they are diverse in their programs, in all their activities, and in their membership. With that, there's also probably around about nearly 20,000 shedders across Victoria involved. At the moment, about 60% of our sheds would be open, and the others will possibly be slowly opening. And out of that 60%, there would probably be about 70% of the men attending. In attending, some are not going back because of COVID and the risk, because some are in their 90s and their families, and they don't want to be involved too much in going outside. Others are just being very tentative at this stage of events. And there are lots of things that sheds are doing when they're opening. They're trying to encourage all the men to have their flu shots. and some are encouraging men to have the COVID app on their phones, those who have them. But one of the things that's come out in regards to the COVID-19, and which has brought all this great discussion and this really worthwhile things happening, is that the men have been really, in Victoria, have been particularly contacting each other regularly. And I'd say that 99% of our sheds have been very regular. Some have been daily, and they've established rosters for doing that. We heard earlier in the other session about phone trees. Yes, we've had phone trees working well. We've had walking trees where they've been out in walking groups. We've had car trees as well. And they've been doing a lot in communities. For instance, at Murrabit, one of our sheds, they've been ensuring in that community that they were also helping others in their town, and the men were volunteering to go and pick up all the shopping. So they were picking up the shopping for people in the community, those who were shut in, picking up medication and mail, all that sort of thing, and ensuring their community remained really involved and engaged. And that was very important for them, and they're still doing that. The men actually in the sheds have got old chaff bags or big plastic bags, and one shedder has been in the shed just getting and making sure everything was okay regularly, but he's been putting things in their bag for them to continue making in their own homes or garages or whatever. And then they've been taking it back to the gate of the shed, and someone's been taking that inside, and then someone else has been coming along when they're all these things and putting them together, and that's been a regular session. Other sheds have been able to, or having to at the moment, they're telling me, to establish rosters. Some sheds are only less than 100 square metres, some sheds are up to 500 square metres, but some sheds have got 5 to 20 members, others have got 20 to 50, others have got 50 to 100, and we have sheds with well over 300 members around, and they're meeting 7 days. Some sheds are open 7 days a week there, and others are open in the evening. We're having at the moment sheds wanting to open to meet the extra time to meet those, because those men, where there's good membership in that shed, and the shed's fairly small, they're having to work out the rosters for who can attend, and they're trying to make sure that roster is an irregular roster, so that all men can get together at certain times over a period of time. And so they're looking at the same time as opening sometimes later in the day or in the evenings. So they're looking at all the opportunities they can, and they've got to speak to council or their landlords as well about all that sort of thing. So there's a whole lot of things have been happening, but they've been using Zoom. Some sheds have been using Zoom. We heard earlier in about people using, having newsletters. Many of our sheds have been putting out newsletters, weekly newsletters, up in the northeast of the state and also in the northwest. The men have been driving out in cars to farms and lonely farmers and seeing them out there and making sure that things were okay with those people. There's some sheds down in the southwest and in the northeast. There's a shed in the southwest where several of the shedders were very depressed, very lonely, and also single men who were suffering from illness or are suffering from various illnesses, and some are partial to getting on to drinking very heavily to overcome everything. At the moment, the comment back from one of those shedders was, well, they've saved his life because he doesn't like being alone or anything like that, and the shed was ringing him twice a day. And that's for the intensity of the care that the sheds are showing with their members in regularly making contact with them. And it was similar in the northeast, where we've got 2 shedders who lost their properties in bushfire, who don't want to be named or anything like that, but who were very close to contemplating putting themselves at risk. They're very depressed, they've lost everything, and yet the shedders there have been helping them, but keeping in also in regular contact with them. So there's some of the things that they're dealing with at the moment. I suppose it comes back to some of the comments that came back. Also, just want to quickly spend a moment on is where we had talked before by people mentioning about what do we do for the future. And I think that social identity, if you like to call it, Hugh Mackay refers to that in one of his books, The Art of Belonging, and talking about online communities. And that's what's been happening as far as our shedders are being concerned. This online connectiveness has been something, but they're still missing very much, and is what people in the communities have been missing, that social contact. And that's been very important to get across and see people. I think it was John and others have mentioned about, you know, being present with people. And I think Rick Kolkoff mentioned things as well. One of the things that's come out, I've been here, dealing with a lot of phone calls as well. When can we open and what's happening? And some sheds are still not quite up to date with things, but they've been putting a lot of pressure on prior to us opening our sheds as from Monday here in Victoria. So it's just giving you a bit of an idea of some of the things that are happening across Victoria. The local communities have been very supportive in terms of helping some of the shedders, and the shedders have been helping them. So one of the things with the Zoom meetings, which was very interesting, is the shedders went to the shed and photographed the shed kitchen or meeting room. And what they did then is they put that into the backdrop for the Zoom. And so the men felt that when they were sitting around, they were in the shed together. But they all say that it wasn't the same, of course, and we realise that, as being in the physical presence. And that physical presence has been very important as far as the men are concerned in being able to see and talk with each other. And many of the men are, even though they're having to do the social or spatial distancing, are finding it really beneficial. I've had quite a few phone calls in the last few days of sheds saying it's great to be back again and see our mates and talk to our mates. And as what Gary mentioned before about shoulder to shoulder or sitting around in the coffee table or whatever and talking and sharing. It's made a big difference to the men with this and this PTSD stuff I mentioned earlier, and having to deal with that and talk to the men is now going to be a bit of a challenge with us to help them in that regard. And I'm finding the same in the community with some of the older people talking about the war and what their parents went through, and how that's reflected all of a sudden when they can remember being shut up at home, and the ration books and the curtains down and everything like that. And that's brought back a lot of, to a certain extent, some fears and stress with some of the older men, particularly those from their mid-85 or 85 unto 95-year-olds that I've been talking to. But we've been able to help them and talk with them and share with them and getting them to feel that, well, when the sheds do open, they can go back properly and share. But there have been also people ringing around to checking on them. And sometimes that's been twice a day. So yeah, that's Lindsay, just about it.
Yeah, just a minute to wrap up for now, thanks.
Yeah. So that's about where we're at and what's happening. But I think the first thing to say is they're still trying to engage in the community, and we've been diverse. We've had some sheds that have been operating as well because they've been out in the garden. So there's a whole lot of things that our shedders have been doing. Thanks, Glenn.
Thanks for being here, Lindsay, and look forward to hearing more from you in the discussion towards the end of this session. So Ken was due to go next, but Ken, if you don't mind, I'm just going to ask if we can squeeze in Stuart Torrance from the Australian Men's Sheds Association. I know he's struggling with some construction works and various things in the background, and we'd really like to hear from him. Thanks, Ken, for the thumbs up there. And then I see we've got James with us as well. So James, you'll be on after Ken. Good to see you, James. So Stuart, could you give us a perspective? Obviously, just introduce yourself and tell us who AMSA are for those who don't know. But any sort of insights you're getting from that national perspective that you want to share from your organisation?
Appreciate it, Glenn, and thanks for letting me have a little bit of the platform to share what the Australian Men's Shed Association are doing in regards to COVID-19 and looking out for sheds and the like. Lindsay from the Victorian Men's Shed Association really did cover most of the subjects and the points that I would have had to have made. We've been doing welfare calls around the sheds over the past weeks, and some of the stories are quite interesting in regards to how the guys have been actually looking out for each other. And I concur with Lindsay's comments about their embracing of technology, especially Zoom, Skype, and all the other weird and wonderful ways. But they've even gone back to old school and have been writing letters to one another, which I think is fantastic stuff. You said that they're being extra careful with those members that are at risk, and that's been reiterated in our calls, how they've come alongside those that are isolated, those that are in poor health, either for themselves or their partner, those that are in, the higher age groups, like in the late 80s, early 90s. They've been giving particular focus at contacting these guys and making sure they're okay. And of course, as Lindsay was talking about the particular gentleman with a drug and alcohol problem, they have focused on contacting those members. And I think that, it really ticks the boxes about what men's sheds are all about. It's about community. We're going to have Ken come up and talk to us later from Omni. Not everybody likes a men's shed. Not everybody is industrially focused, etc. And I think there are a lot of groups like Omni, like Rotary, Lions, that are all fantastic organizations for men to be a part of, because what men get from those sort of organizations is that sense of community. And I think that's one of the things that COVID-19 has tried to take away from us. And we've actually stepped up to the plate, and the men have stepped up to the plate and reached out to one another in a fantastic way and ensured that they're all taking care of one another. Lindsay really did cover just about everything. And I'm thinking that Lindsay's actually been listening into some of my phone calls with some of the sheds. But one of the stories that I really liked was when we first started making these welfare calls to the sheds. Quite often we would ring the president, the secretary or treasurer and just say, look, we're doing welfare calls. Have you got 2 minutes to chat? Oh yeah, no problem. How's your shed traveling? Well, of course, we're closed down, but I did go to the shed for a security check the other day and there were 2 members inside. And the 2 members were saying, we're being careful. We're looking after work health and safety because there's 2 of us in here. It was more important that they got together in the shed than anything else. So some sheds have actually had to change the locks on the doors. And it's those stories of the camaraderie and the blatant disregard for anything else other than their community that really uplifts my spirit and makes me embrace sheds even more each and every day. But like Lindsay was saying, the sheds that went that extra mile, they knew the people that weren't able to get out of their houses and go and do shops, so they would go and do a shop for them, take it back, knock on the door, and it was a bit like the knock and run some of us used to do as kids. They would leave the parcel of shopping, bread, milk, all the basics at the front door, knock, go down to the gate of the house and give them a wave. They know 2 things: they're cared for by the community. These men go out of their way for them, and that they're being looked after. Some of these country communities are even have even embraced their whole community and made it their point to actually start ringing not only the Menshed members, but the members within their community that may be out on a farm or something like that. So all these fantastic stories. I think Mensheds have really stepped up to the mark when it comes to COVID-19. Yes, they're all really tugging to get back in the door, and I'm glad to hear that 60% of the Victorian sheds have gone back in. But I did note on a lot of the calls how some are holding back, and rightfully so, because the membership of Mensheds across Australia is in that high risk group. And there's guys with ill health, age, and the like that probably shouldn't be rushing back into the shed, and they're being overly cautious. So sometimes when people say to me that men don't care about their health, I have to stop them and, you know, literally tell them that men really do care for their health. It's that important that they're prepared to give up something that they love to participate in. Anyway, I've talked enough, I think. I've got to go and build a retaining wall. I'll pass it back to Glenn, if I may.
Let us never stand between a man and his retaining wall or his whatever project he has. I really appreciate you finding time to be here, Stuart, and sharing your experiences from the perspective of the Australian men.
Thanks for the opportunity. Take care, guys.
Very welcome. Bye, Stuart. So next up, getting down to an actual local group. So we've heard from a couple of people representing a range of groups. So now getting down to an actual local group. Maybe a couple of weekends ago, I was thinking, who else can we bring into this conversation? And then I remembered, Omni, Older Men, New Ideas. There are some Omni groups around the country. Surely some of them must want to be involved. So I sent a very quick round robin email, and within seconds, I had a message back saying this. I'm Ken Young, and I've been involved with Omni since February 2006. I'll be happy to share our recent Omni Zoom experience with anyone at any time. And true to his word, here's Ken Young from Omni to tell us about what his group have done in response to COVID-19. Thanks for being here, Ken.
Lovely to meet you, Glenn, and have this opportunity to talk. And you've mentioned Omni. It's had a couple of mentions today, not as many as I would like, but it's a Code of Victoria program of older men's discussion groups. It originated in New South Wales, where the name was derived from the Older Men New Ideas. But sometimes some people say no ideas, and but I say never isolated. These are not support groups as such. They can't provide remedial support for those with mental health issues, but in my opinion, they are an effective measure in preventing isolation, which I think this morning has been one of the key focuses of some of the other speakers. But these groups can result in providing support for those who participate, and I could go on all day telling you various stories about those sorts of situations that have occurred. The format and the guidelines are actually based on support group principles from the New South Wales Mental Health Association. I think they have a manual, by the way, if anybody wants to know how to run a group. So the more that men put into this activity, the more they get out of it. It creates friendships. And what other support do you need when you've got friends? It's great to have someone to call and who will listen. We learn to listen in Omni. It's not just a discussion group, because only one bloke talks at a time and all the other blokes are listening. I don't need to say anything about that because Glenn's already covered that. I joined a new this is a local group in Greensborough. I joined it in 2006 into Greensborough RSL, and it's been the most fun that I can remember having, apart from the obvious, of course. But I've made numerous good friends since then, and the more than I've ever had before, and of course over 14 years I've lost some too. In the past I've also been involved in men's sheds. In fact, I was a foundation member of the Victorian Men's Association and involved in the development of the West Heidelberg Men's Shed. But Omni-Med's discussion groups work best for me. It works well for those men who like a chat. It's not for everyone. I feel it would be much better world if men talked more, particularly about their frustrations. We're all different and we all have different needs. It's not in competition with Men's Shed or any other popular activity for older men, but it is unique. In fact, 6 men from the Eltham Omni group, which is Eltham, hang on, which one? Eltham Hurstbridge. No, I met Philip Green, who was the earlier speaker at the Hurstbridge Men's Shed, just by the way. He was looking for something to do, and the rest is history with Philip and his men's dens. Where am I? Yeah, so the 6 men from the Eltham Omni group helped Eltham's Rotary to establish the Eltham Men's Shed. So some men attend both activities. My father used to say, there's more ways to kill a cat than choking it with butter. Omni is just one of the many ways we need to cater for older men. And I see on your website there, Glenn, a whole list of, I think I counted 16 different organisations, dads groups, Man Walk, Men's Table, Grab Life, etc., etc., etc. So there's plenty of activities for older men. It's just getting them along and getting them out to them. So Omni is just one of them. Cater for older men. It's practical and it works. It works for more than 300 men involved in Victoria, and there are more involved in New South Wales. All we do is talk. We have a structured meeting, and we've got guidelines for us to follow. One man takes on the role of facilitator to make sure the meeting works well. The top guideline is confidentiality. This makes the men feel safe and secure. Trust within the group builds, and it becomes obvious to any newcomers. We can have laughs and we can have tears. When we did a survey back in 2010, over 100 men were surveyed, Omni men. We found the main attraction was camaraderie, and that's certainly similar in men's sheds, I'm sure. The second main attraction was topics and discussion, because the group aims to nominate a topic of each meeting for discussion at the following meeting. During the COVID-19 shutdown, that is my little Greensboro Omni group. Oh, I've got a photo I can share. Can I do that, Glenn?
Yeah, give me a second to change the settings, and you'll be able to do it in just one moment.
I'll show you the group anyway. So during the shutdown, we began Zooming every week, because we only normally meet twice a month, although some of us would regularly meet for coffee on the off weeks. Actually, 4 of us went down for coffee yesterday at the Greensboro Plaza, and the coffee shop was widely spaced. We did all the right things in that respect. So on Tuesday this week was our 11th Zoom meeting for the group. We did have a couple of trial meetings before that, so that we have some people who've had experience with Zoom, and so a couple more of us could learn how to use it, so we could work out how to be hosts and so on. I'm a member of just one of 29 Omni groups in Victoria. Some groups only meet once a month. Some organise lunches and trips, etc. They're all different. They're all self-managed under the umbrella of CODA, which is very important. For those not Zooming, there have been group monthly newsletters to keep in touch, plus a few phone calls. Can I share the screen now?
Yeah, should be able to share it now. Have a go.
Oh, there it is there. Okay, share, click on share. So this is the Greensboro Omni group at their July meeting, first meeting in July. We have a couple of meetings each month, first and third Tuesdays. And can you see my little arrow? That's me. And this is Ray, who has his birthday on the same day as I do, 5th of July. And Johnny over here has his birthday on the 4th of July. So we decided to have a cake in July and we celebrate everybody's birthdays. Sadly, we lost poor old Carl here just recently, although we did manage to get him up on Zoom with the help of his daughter, son-in-law, and Keith managed, who was also 90, in his 90s. Both these blokes are on the right-hand end are World War II veterans. Keith came onto Zoom, and with the help of his son-in-law, I think. Carl had a lovely family, and he only passed recently. We knew he was on his way out with liver cancer, but he really loved his Omni meetings. Yeah. For those not Zooming, there's a monthly newsletter to keep them in touch, plus a few phone calls. Our volunteer, Alan Bull, in the Dakota office collects details from all the Victorian groups on what they were doing during lockdown. I believe it was these reports from Dakota that you caught your eye, Glenn.
Yes.
Alan maintains the attendance records for all Omni groups, just by the way. I'm suggesting we have a break just there if there are questions and so on. I've got another couple of pages to go, but
yeah, no, that's good. What we'll do, Ken, you've given us a really nice sort of insight into your world, and that picture is fantastic. I'll ask you to stop sharing your screen now so we can say goodbye to the fellas. And when we get to the discussion side, discussion part of the day, we'll come back to you with any questions. And also in the meantime, people can also remember post. Some people are here. You can post comments and questions at any time in the chat box. I encourage the speakers to keep an eye on that, because often people are posting things while you're speaking, and it's worth going back and having a look. So Ken, that's fantastic. Thanks for what you've shared so far. We'll definitely be coming back to you for more. It's the first time I've really seen inside an Omni group, so thank you, because I've been aware of them for many years, but you've given us a bit of a feel inside. You know, we talk about the practical stuff of, you know, this is a shed that does projects, and this is an Omni group that does talking, and we've got Shed Happens coming on later on, and they say we do stories. But what we miss in that is actually, and what I really got there is, it's about community and connection and friendship, and it just happens that the discussion or the project or the storytelling is what enables that community, those connections to come together. So I'm just going to go to now James Wild at Men's Sheds WA. James, I think may have slides, so I'm just making you co-host so you can share your screen, and you'll need to unmute yourself so we can hear you. So this is James Wild. Only had a brief chat on phone once. I think you'll pick up that when he starts speaking, we've got something in common. See if you can guess what it is. And I'll just open the mic to you, James, and give you your sort of 10 minutes to tell us about what's happening over your side of the country.
Thanks, Glenn. I think most people will pick up that it's the accent that we've got in common. It's not the hairstyle. Good morning, everyone. As Glenn said, my name's James Wild. I'm the CEO of Men's Sheds WA, the peak body for men's sheds here in Western Australia. We represent over 180 sheds over in WA, with roughly about 7,000 members. Interesting to listen to Lindsay's presentation, Stuart's and Ken's, and kind of pick up some of the points that have been made in those presentations. And I think I don't want to bore the group. I think I'm probably going to reiterate some of those points, but I think they have been clearly prevalent issues, not just in WA, but across Australia. And as Glenn was just saying, then community connection, friendship, have really been at the core of what Men's Sheds of WA has been focusing on. As soon as the call was out for sheds to close down, it was how do we carry on with that sense of community? How do we carry on with that sense of mateship that sheds are very well known for, in a time when they can't actually physically meet? And this has presented some significant challenges, obviously, for the shed network. And just give you kind of a bit of a snapshot into my background. I previously, before joining Men's Sheds WA, my roles were very much centered around social impact, and I was doing some pieces of work on social impact in Western Australia, and a part of that was looking at what's called the WA Index of Wellbeing, so measuring well-being in people and measuring well-being for WA, to understand what it's like to live in WA and what that means for the different groups of people, different categories of people and different sections of society. And one of the elements which has just really come to the forefront in recent times has been around digital inclusion. One of the parts of the Index of Wellbeing was, how do we measure, I think it was titled Smart and Innovative Society. So what does it look, what does a smart and innovative society mean, and how does that intrinsically connect to well-being? And there's a lot of data out there. I mean, apologies again if I'm sharing previous data that's been shared on the call, but 34% of Australians over 50 plus, which is 2.7 million people, have low digital literacy levels and do not use digital, and some of them don't use digital devices at all. And we've experienced that very much so in the last few weeks, that obviously the easiest way to connect, if you're not going to be meeting face to face, is to connect online. But we've got perhaps one of the toughest groups of people to connect online. The stats out there show this, the anecdotal evidence, the conversations that we had with sheds. A number of the conversations I was having over recent weeks with sheds, where we'd have perhaps one or two members of the sheds had an email account, and the rest don't even use the internet. So the demographic that we had has been an interesting demographic, but a challenging one nevertheless. Part of my role is to connect with other bodies, to connect with other peak bodies, which we've been doing every week. The WA government and WACOS, the WA Council of Social Services, has been great in facilitating some of those opportunities where we can share best practices and ideas, because what we seem to have found is when we started this process of how do we connect some communities and how do we support the men's sheds as best we can, we found that there was no point just running off and doing things on our own. It was better to share the resources that we were coming up with. So we've had some really good conversations with the likes of the Country Women's Association. Obviously different demographic, but sharing a lot of the same issues. And we've been able to share our resources, share our information sheets and all of the literature and guidance that we've pulled together, and likewise they've shared it with us. There's also Link West and Connect groups here in WA that connect all of the small community groups, and we've just been able to really kind of pool those resources so we can, to the benefit of the groups. But what we have found is that while the CWA, for example, have really taken off with Zoom meetings, and their demographic seems to have been able to adapt very quickly to online meetings, we've not had the same uptake and the same numbers that they have, which is really interesting. I think for me, it pulls out some kind of key learnings that we can take forward beyond COVID-19. I think it doesn't help that we want to be able to provide as many different opportunities to connect as possible. And sheds are great to have people turn up and get involved in activities and engage in activities. But this really does flag up, what about those vulnerable people that can't access the sheds, that can't go in weekly, that might only be able to operate, particularly at the moment, operate in their own home. So how do we connect with those people, and how do we identify who those people are, and how do we kind of spread this across our network, so it's not just Men's Sheds WA banging the drum, but how do we get the sheds active in this as well, to understand how they can connect with their wider communities. So and I'm sure Lindsay and a few of the others that are involved in the Men's Shed movements will hear similar stories from sheds where you say, oh, my shed's at capacity and we can't take on any more members. And I think this has been really a useful insight into that. Well, yes, you might not be able to take more members on in terms of how many people you can fit in a building, but if you have a membership that is connected through WhatsApp groups, through the internet, and we can provide that digital literacy and learning and support for the age group that we're dealing with, or the main age group that we're dealing with, then there's an opportunity there that we can expand the sheds into a much greater reach into their communities and support even more people. Some of the things that we have been doing in Mensheds WA that's to support the groups, again reiterating some things that have gone before: Zoom meetings. We've put out quite a number of information sheets around cleaning, and even just around the COVID safety planning and how to write a COVID safety plan, how to put the COVID safety certificate, where it should go, and just kind of the general guidance that's very specific to COVID planning. But also we've run weekly events as well, weekly online events around food health, mental health, just really thematically designed to be of use and to support sheds, but also really just to provide an opportunity where people can dial in and get together and have a chat. What seems to have worked well has been a weekly dial-in with no agenda, with Mensheds WA, where the team is here available just to chat to anyone in the shed. So each week people can dial in and talk about whether it's COVID or specific issues. So we've kind of been as diverse as possible in what information and what support we're providing to the sheds. We also run a weekly listening event, and this was an interesting take that we had. A gentleman offering what was called the listening shed. He was going out to a number of sheds and providing talks on how men can be better listeners and how men can better engage with their groups. Obviously, when COVID happened, that got shut down pretty quickly, and we had to think of other ways that we can deliver that support. So he's run that and carried on running it every week since shutdown has happened, as an online listening event. So we're getting some good attendance there and some good contributions from sheds. I think we
got a minute, James.
Got a minute, right? Well, if I've got a minute, I might just share my screen with you, because we've just undertaken a COVID-19 shed survey. So let me just see if I can find, where's share screen? Here we go.
Yep.
Hopefully, can you see that?
There, we're on, yeah.
Excellent. So this was as at 31st of May. We had 80 respondents out of the 180 sheds, and we got most of those back in the first couple of days, which was great to see the appetite to contribute. Couple of snapshots here. 63% of sheds as at 31st of May had reopened, according to WA state government advice, that we obviously with the conditions that apply. 35% decided to remain closed, and 2% are actually uncertain about the future, so whether they will be able to continue as a shed. And this has been useful for us as an organisation to see where the gaps are and where the weak points are, where we can support the sheds that have that uncertainty. During the crisis, sheds remained in contact with, as you can see there, hopefully all members, 68%. So quite a high number of them have actually managed to keep that contact through. And I think the next piece there will show you how they remained in contact: WhatsApp groups, Zoom meetings, by and large, email updates and newsletters. But obviously, if that's the preferred method of contacting and reaching out to the sheds, this does kind of conflict with the digital literacy and opportunity to engage online. So I think that, just to explain what that graph is in front of you, the left-hand side is how sheds have engaged, and on the right-hand side is the question of, well, post-COVID-19, are you going to continue with these? So 98% will continue with email updates and newsletters, and obviously the strange one there is the in-person meetings and gatherings will obviously kick off again for sheds. 74% of sheds completed a COVID safety plan, 51% displaying the certificate that just reflects that not many of them are open. I think probably just to finish off, that this is the one that I think has been of most use and most interest. So we have a diagram here, not well in the middle and well on the outside. Were your members able and confident to use technology during the crisis? And you can see the darker colours there, 20% didn't engage well at all. Most members don't use technology, not well, and then neither good nor bad. So the indifferent down to the not using at all is pretty much 50% of the respondents. And well and very well again make up the other 50%. So technology is something that is going to have to be a key part of our plan going forward about how we engage sheds. The other things I think were actually also of equal note and importance. Do you believe that your shed has coped with the crisis? There's only 4% that said not well, and neither good nor bad 17. By and large, I think the sheds believe that they've been able to deal with this and to manage with it. And most reassuring, if this shed is the shed prepared for a second wave of isolation or a similar future health crisis, most feel that they're in a good or better position to support their sheds. So I think in summary, I think for ourselves, MenSheds WA, the richness of the information, the richness of the data that's coming back to tell us where we should be focusing our efforts has been invaluable. There's not a great deal of silver linings to a global pandemic, but I think in this instance we've got some information that tells us not just about how we support sheds during a pandemic and during a crisis, but how we can better support the key demographic that makes up our sheds. And I'll leave it there and obviously pick up questions later if that's okay. Absolutely. And again, do drop any questions or comments in the chat box for James to look at too. Thanks, James. Really good demonstration both from yourself and from Lindsay of that value of having that kind of peak body that's operating on behalf of a group of sheds. And that 50-50 thing you pointed to, roughly speaking, 50% of the guys adapting, 50% not so well or indifferent. And I think that's something for us to keep in mind, because we're mostly talking here about the success stories, which is fantastic, but it's important to remember that there are men are falling through the gaps. And obviously we're only looking at the men we already have in our communities, and there's the older men that are outside of them. So there's these amazing examples of really great practice, sheds, Omni groups, I'm sure Tomnet, who's coming up in a moment, all sharing examples of how they've managed to stay engaged well with the older men, and how the older men themselves have actually played that role in staying connected with each other. And of course, I think we need to keep mindful of the fact that who are the ones that are invisible. Who are the older guys that are invisible, who are not getting picked up in our communities. So I'm going to come now with I think the next speaker is going to fight with you, James, for the youngest bloke on the panel, and a slight shift from sort of the community model to looking at an organisation that's dealing with more medical issues, but very much from the community perspective. So Chris McNamra. First time I met you, I think you were actually working as a prostate cancer nurse, one of the only, correct me if I've got this wrong, Chris, but I've known Chris just a little bit, and I seem to remember he was one of the few male prostate cancer nurses in the country, and has now moved to a role at the Prostate Cancer Foundation. But I'll allow him to tell his story and to share with us what the PCFA have been doing for the men that they take good care of. The floor and the microphone is yours. Thanks for being here, Chris.
Yeah, so we did meet at an awards last time here in Brisbane for the Men's Health Awards, and it's a bit shocking that there's only, at the time, there was only about sort of 6 of the 50 nurses were male, delivering a male health service. So we even had discussions there about some, possible research opportunities about the care delivery and things like that as well. So I'm just trying to share my screen. I've got a couple of slides to run with, but it's not Here we go. Perfect.
Got it? Good.
Yeah. So we'll.
There it is. Yeah. So if you want to enlarge that, we'll get that's it. Brilliant.
Right.
Over to you, Chris, all yours.
Okay. So thanks again, Glenn, for having me on. It's always a good opportunity to talk about men's health, regardless of whether I'm sitting in a nurse's seat or now working as head of community services for the PCFA. So it was a pleasure to come on today and talk about the impact of coronavirus on older men. We've been receiving a lot of inquiries, and our services have been kind of stretched during this COVID crisis at present. So I'll just start the first couple of slides off by sort of talking about where PCFA comes from. You know, it's there for the guys that are suffering prostate cancer and their families and friends, and it's a broad-based community organisation and the peak national body for prostate cancer in Australia. We don't want to see anybody die from prostate cancer, so we're doing a lot of research and support behind the scenes to someday see, obviously, no man die from prostate cancer, and that's our vision for the future. Mission, of course, is to reduce that burden, as everybody's is, and have that sort of world-class psychosocial care. There's really, really big gaps in cancer. Listening to a few of the conversations that some guys have had this morning about, you know, how much services have changed recently in the cancer game, especially that support, compared to where we were even just a few years ago. So it's a real bonus to be able to be involved in all of that psychosocial care surrounding cancer. So our focus, obviously, to be there for the guys, Australian-based prostate cancer research, and protecting the future. We really, as I say, don't want to see anybody have to die from prostate cancer in the future, and improving the quality of life surrounding treatment. As we see a lot more guys being treated earlier, then they're living a lot longer. So, you know, the length of life and quality of life have increased dramatically. A few little numbers there. So you're looking over 20,000 new guys every year, and you've got about 200,000 people living with the diagnosis of prostate cancer at present. And down in that bottom left-hand corner there, men diagnosed in regional rural areas, 21% less chance of surviving of prostate cancer. Just listening to James's talk before about the geographical isolation in West Australia, you know, we only get to see a little bit of that. So it's a really in-depth report or survey that you had there that's got some really vital information, and we probably didn't see it as much from the PCFA, but probably smaller groups have definitely experienced that during COVID. A couple little slides about coronavirus. I'm sure that we're all aware of it. It's kind of turned everybody's lives upside down, so we've all had a pretty vested interest, but we get information, you know, quite regularly about it. We all now know to cough into our elbows. We all know to wash our hands. I don't know why people weren't doing it in the beginning, but hey, here we are. And there's no vaccines or anything as yet, but, you know, time is of the essence, I guess, when it comes to it. Cases there's probably 6.3 million at the moment worldwide. So it is a pandemic, and it is affecting, you know, older men, not just within our community, but also all over the globe. So when you have a look at the WHO's policy brief from March this year, you're kind of looking at a few domains there of, you know, economic well-being, the income, the living standards of older men are being affected. The physical distancing really takes its toll on that mental health of guys that are already perhaps isolated. Responders, this is something that, you know, I've spoken about this in the past. It's not just those affected by coronavirus or think that it's just the older community, when they are the responders as well. They're the healthcare workers, the essential services that are involved. And if these guys are fearing for you know, what might happen to them from an infection of coronavirus point of view, and they're on the front line, so that really does affect you know, the older community a lot more. Life and death, comorbidities, and an increased risk. Obviously, a lot more fear surrounding that as well. Vulnerability. So we're always made aware of the most vulnerable in the community, and, you know, we take into account those with the comorbidities, but those that are also living within care homes, are also quite vulnerable during this pandemic. And the abuse and neglect, there's some pretty hot topics going around that this week as well, just from a general point of view coming out of COVID, let alone the older guys during COVID. So it's been on the rise due to the lockdown and reduced care as well. Priorities for action from whom? Pretty standard there. You know, you're ensuring difficult healthcare decisions that are affecting old men committed through dignity and the right to health. That should never be on the back foot during a pandemic like this. Strengthening social inclusion and solidarity during physical distancing. We've heard really great stories of how the communities have, you know, stuck together and including everybody as much as they possibly can without, you know, with social distancing. Fully integrating the socioeconomic response to COVID and expand that participation. So getting the guys involved a lot more as well, as much as possible. What are the impacts of coronavirus on older men, and especially with prostate cancer? It sucks. Social isolation, we've all done it. I've got a 2.5-year-old. I know what it's like for just me, but imagine when your social networks are cut, you're not technologically savvy. You know, these things really have devastating effects. And from a health point of view, especially in the prostate cancer space, we've seen about a 60% decrease in testing. So that's for guys that are on active surveillance. You know, we're watching these guys with prostate cancer and they haven't had treatment yet. So these guys are quite vulnerable to tip over into nasty disease if they're not tested appropriately. And guys have been skipping out on that test. So that, as I say, 60% decline in testing from this time last year. So, you know, that could lead to some pretty drastic treatments happening for some of those guys later down the track, again, coming out of COVID and, you know, being affected by a lot of things from there will also add to that anxiety and stress and depression surrounding a diagnosis or a nasty diagnosis of prostate cancer in time to come as well. And look, there's always that fear of death. I mean, you get an infection, you're fearful of how you would fare, and we all think the worst. So it is something that's quite on the mind for guys as well. Men are more risk of worse outcomes and death, independent of age, with coronavirus, but it's still there. While males and females have the same prevalence of coronavirus, male patients do have a higher mortality, especially then adding on top of that comorbidities and age as well. What has it taught us about?
About a minute, Chris, if you can work towards wrapping up.
Yeah, sure. So what has it taught us? Isolation sucks, resilience. So technology has been a really, really big spike, contrary to a few of the other conversations. We've seen a lot more of an uptake within online communities, etc. It's no longer foreign, but it still has its challenges with rural, remote, and generational indifferences as well. We've seen a lot more random acts of kindness, care packages, all those sorts of things that are all really good, feel-good stories. We all know about the toilet paper debacle. It's funny now, but it was scary at the time for people who can't just get basic items. So a lot of organisations jumped on board, Woolworths, Coles, local independent grocers, to do a lot more for the older community in regards to getting them staples that they did require, opening up early, online deliveries free for certain ages, those sorts of things. Same with groceries. This is a pretty common theme. Everyone's probably seen an aisle like this during the crisis. What services did we already have out there? Phone and email support, telehealth, online environments, they all work really great. But the future of it, where is it? You know, there's obviously a multitude of things that we do from the Prostate Cancer Foundation point of view, where we have online forums, online communities, we've got webcasts and webinars, podcasts, all these things to try and make sure that everybody's getting the relevant information sort of at the right time. In a previous life, I was a community nurse as well. So I used to drive guys, older men around for shopping and doctor appointments and things. So telehealth is really going to open up that avenue of saving some stress and finances as well, and boredom of sitting around doctors' offices and things like that. So it'll be very interesting to see where we do go from there. But from the...
Okay.
Yep. PCFA's point of view, we did a lot of things just engaging the community. And the big thing is making it really clear, concise information and appropriate. So we did a lot of fact sheets as information was coming to hand to alleviate the concerns within the community, as well as utilising everything on our social media channels. There are some gaps we've seen identified. So we'd like to see a little bit more of trying to engage that patient cohort that just can't, always, not able to have a good internet line and technology and things. So got a lot of programs in the pipeline for connecting those guys as well. Peer support telephone programs, peer support one-to-ones, those sorts of things.
Great.
And just making it more male friendly. That's the really big thing. Male friendly conversation, communication and engagement as well. So there you go.
Right, and that's fantastic, Chris. You've covered so much information in a short period of time. Please do also copy and paste those details into the chat box during the next session. Your contact details, and I think there was a slide there with more information which we didn't get to look at. So please copy it in the chat box, and people can see that, and we also save that afterwards and make it available where people want it. Really, really rich presentation with loads of information, and we're pressed for time, so I'm going to jump straight to our next speaker. Thanks so much, Chris. So our final speaker in this session comes from another of those projects that if you've been in the men's health space, you hear it mentioned over and over again, but you often don't get to find out what's going on. It's over there somewhere, and Toowoomba is over there for a lot of people. It's a long way away, and even though I'm up in central Queensland, Toowoomba does seem a long way away. And the organisation is Tomnet, the older men's network. And one of the real positives that's come out of COVID-19 for me is I finally managed to get in touch and get face-to-face via Zoom with Tomnet. I think this is maybe the third or fourth time we've actually been online together. So we've actually got Louise Adcock from Tomnet to tell us a bit about their work and how they've been facing up and their community's been facing up to COVID-19. Really looking forward to this, Louise. The microphone and the floor is all yours.
Thank you very much, Glenn, and thank you very much for the invitation to participate. As I said, it's actually been a fantastic week, so congratulations to your team. And we probably wouldn't have had this opportunity without COVID-19. So there's the first silver lining, and particularly these conversations around older men. And the whole week has just been fantastic. So as Glenn introduced, I'm Louise Adcock. I'm the General Manager of the Older Men's Network and have been so for 8 years. Yes, I am female, but I'm not going to apologise for this because I'm absolutely passionate about reducing the suicide risk in older men, and often sometimes a different perspective helps that. So in saying that, my background has been predominantly in agriculture. I come from driving tractors, headers, etc. But I've also spent over 15 years setting up peer support groups in agriculture, and successfully so. All of them are still going, despite me leaving them 10 years ago. But the key principles are really the same about breaking down the barriers, creating a safe space, and strictly adhering to a safe environment, and helping people to think outside the square. In terms of Tomnet, so who is Tomnet, and why has the investment in a resilient and sustainable network been so powerful at this time? And the most amazing thing has happened with COVID-19. We do a lot of face-to-face activities, and obviously we had to shut them down because of the vulnerable nature of our blokes. But we really didn't miss a beat because of the way we've set up our network. For those that don't know about Tomnet, we started in 2001, so we're about to celebrate our 20th anniversary by 8 men who were watching their mates really struggle after retirement, or who chose suicide. So we now have a growing network of around 500 across southwest Queensland, and as Glenn mentioned, we're based in Toowoomba. We really support men over 50. And our age group goes from 50 through to 100. and a lot of them are struggling with the fundamental life challenges as they age, and many have been talked about today. So retirement is one of those first losses that that men face, and then it's exacerbated if it's forced retirement, and then comes the losses of health and moving towns, losing health, and losing their lifelong partners as well. To counteract that, we've basically set up a program, a support program specifically designed for older men. It's focused around helping older men develop a language, around actually find an emotional language, helping them recognise anxiety and depression, to help them develop strategies to manage this, and to connect them to the appropriate resources. So one of the aspects, obviously, we were doing that face-to-face, and now with COVID-19, we've been able to move that into a Zoom format. And that provides a real opportunity for us, because the benefits, any bloke that's been through the program has found the program so fantastic, and they wish they had done it earlier. It really helps them plan retirement, which is something we don't do. We plan for our careers, but we don't plan for our retirements, which is 30 years long. So it's allowed us to set up a support program that we can now probably hopefully tap into any bloke in Australia and maybe even the world. So that's been a real positive with that one. What we then do is then help our men connect with a peer support network. So they come in, we provide them with support, but we connect them to a peer support network that is underpinned by a charter of older men supporting older men. And this has been since the outset of Tomnet 20 years ago. So we invest really strongly in this. We basically invest in one to help others, for them to then support another, and to do so meaningfully. And the safe environment is paramount, and they learn to trust each other with their emotional issues. So with that motto of older men supporting older men, this has just come to the fore with COVID-19. We encourage all of our guys to reach out to each other, but we had also encouraged them to reach out beyond the office door, the centre door, well before COVID-19 hit. It was all about creating a long-term mental health support network. As I said, and therefore, we've effectively, if you're in Queensland, they've created a care army. That's been a permanent feature of Tomnet, because that is just what we do. The last piece of our puzzle in helping blokes get back on track is our resilience strategy, when we help men discover their purpose and identity, and to live the rest of their retirement chapter meaningfully. It's really important for all of our blokes to remain connected to the community, and therefore that's why we have a range of volunteering programs that we do in teams. We have over 70 volunteers working in teams, because again, it's that shoulder to shoulder connection. We're in aged care programs, and we run with groups, which is not dissimilar to what Phil was talking about this morning. Our telephone support program has just come to the fore in this time, and it's really about helping those who couldn't, some have connected by Zoom and some haven't. We haven't pushed them because it's obviously a very stressful situation, but grandkids have been a fantastic tool in terms of helping many of our blokes get connected during this time. We have our affiliate group support. We have a barbecue cooking service. Obviously, that's shut down. Our home visiting program has had to shut down as well. But again, we're using telephone to reconnect. We also have a fabulous mentoring program with disadvantaged youth through the school-based system here in Toowoomba, and also linking into a driving program where we help disadvantaged, PCYC, help people get disadvantaged youth get their hours up, basically. So some of those programs that we haven't been able to run, but we've been working with Flexi School to see how we might be able to do that. Again, disadvantaged kids are just as much at risk of not being able to access technology as our older men. So there's some significant challenges around that. Our need to set up our group sustainably was driven by 4 key reasons. One, I think long-term mental health support should be sustainable. and it should be based on creating independence, not dependence. I think it's also psychosocially responsible. So when you offer vulnerable people support, then withdraw it, often leaves them more at risk than they were without any support at all. But it's also about really addressing the key factors that contribute to suicidality, and that's really our programs are flexible. It creates resilience in men. It creates a pathway forward, creating hope. It maintains their independence, and it recognises they are still a valued and perhaps still a valued part of our community. And we talked about ageism earlier this morning. But it also gives them a sense of belonging. And that's what's been so special during COVID-19, is that they are still remaining with that sense of belonging during this time. The last factor that's really driven it has been funding. We were funded under the National Suicide Prevention Strategy, which was then handed over to PHNs. And over my 8 years, we've been running on 6-month funding contracts and the challenges. So it was just really critical to make sure that our blokes weren't left without support. But as I said, didn't know COVID-19 was coming, but we were set up extremely well to manage that. And our blokes are just connecting with each other and doing all of the things that have been mentioned in the previous 5 speakers. So we will modify a lot of what we're going to do going forward, and we will integrate the tools of online. We've been running online counselling sessions, and we will keep a portion of those, but face-to-face is still important. And I know our guys are biting at the bit to get back to meeting face-to-face, which hopefully will be in the not too distant future.
Okay, 1 minute, Louise, thank you.
Well, it just about sums it up, really. But I do, if I may say, which is a slight issue, and it probably connects to this morning's discussions. I really do want to commend you, Glenn, for the organisation for this week, but also for the recognition of older men as an equal cohort that are impacted by suicide. It's been a battle that I've been having for 8 years in trying to get that point. 36% of all male suicides are aged between 50 to 100, and 72% are aged between 50 and 70-year-olds. And it's part of our passion of how do we help these blokes live a really meaningful retirement. They are a worthwhile investment, and they are a valuable and can continue to contribute in a valuable way to our communities to their dying days. So I commend you, and I commend that, as I said, listening to some of the bigger players talk about policies and that real need for prevention as being important. We've been focusing too much on the other end. So congratulations.
Thank you. And hasn't it been great that we've had so many speakers who themselves today are men over 50, right?
Absolutely.
And isn't it fantastic we've got women who care passionately about older men too. So it's I always have to be careful when I say that. And when I say care passionately about older men's well-being, it's probably the better way to say it.
Good way of saying it.
Yeah. So thank you, Louise. When I hear an organisation like Tomnet, it's one of those organisations that my brain automatically goes, we need a Tomnet in every town. And of course, often the power of these organisations is they're built from the grassroots up. They're not just dropped from the top down. But what's great is that I hope people from around the country hearing more about Tomnet will be inspired to just take better care of men in their communities, whether it's through a Tomnet or a shed or any of the other kind of approaches that we have today. So thanks for all you do. Look, what you've been speaking about will take us nicely into the lunchtime lecture, which is on suicide prevention in older men. We've run right up to the hour. We dropped in an extra speaker there, so we've had a lot of speakers. But I do want to make sure we at least go back to all of the panel. And Lindsay, are you still there? I'll give you each sort of 1 minute just to sort of say, anything that you've heard from the other speakers that you want to reinforce, or anything you feel you didn't say which you feel you want to say. And I'll just go around the same order we started. So Lindsay.
Thanks very much indeed, Glenn. It's been brilliant, and thank you very much for organising this. This has really been excellent to participate in. I think the thing that stands out for me is that everyone's very caring and following through with the men, and very keen to assist in what ways we can and look after them. And that's been quite apparent with the sheds in Victoria, but looking after their men and members. I think that's very important and following through. So that just, yeah, that's about all I'll say at this stage. Thank you, Glenn.
Perfect. That's Lindsay from the Victorian Men's Sheds Association. Thank you for being here, and thank you for all you're doing for blokes across Victoria. I know Stuart from the Australian Men's Sheds Association has had to move on to work on his retaining wall. So I'll come to Ken Young from the Omni Groups.
Thanks, Glenn. Yes, so all I can say, it's all on the Code of Vic website, www.codeofvic.org.au. It's in the chat list. Leave it at that, Glenn. Thanks very much for having me.
Right. Thanks for being here, Ken. Really enjoyed seeing you inside your Omni Group. That's Ken from the Omni Group in Victoria. So James Wild from WA Men's Sheds WA.
Yeah, thanks, Glenn. Thanks for the opportunity to speak. It's been a great event, and good to see the range of ideas and presentations. It's been very, very useful, and scribbling away my notes as the speakers have been talking. For me, just probably one comment I think that I probably missed out of my initial presentation was just around WA, and I noticed in the comments the scale of WA and the remoteness of some of our communities, and I think this obviously just kind of resonates with COVID-19, that how do we connect with those communities? How do we ensure those communities, by and large, are not isolated, let alone the individuals that are attending the sheds, but also the communities? How do we bring them closer to the network? And I think some of the innovative ideas that have come out of COVID-19 and the response to COVID-19, I think, have paved the way for new best practice, and something for us which we'll be sharing with yourselves and the groups as the year goes on. We're doing a change in kind of our approach and our literature that we're sending out to the communities and to the stakeholders and partners, and really focusing on some of the conversations that have been talked about this morning around the benefits to the community, the benefits of kind of supporting this cohort of individuals, the benefits to both them and to the communities themselves, rather than have the perception of men's sheds being guys just coming together to do a bit of woodwork. I think we all know, and you can see from the people on the call, that there's a lot more depth to that, but I think that perception still isn't there in the community.
Great. Thanks, James. Thanks for the insights you've brought. Thanks for that great research as well, the survey, which gave us a flavour of what's going on across a large group of sheds in WA.
Thanks. And I've shared that in the comments as well. Right. It's there, so if people want to access it, they're welcome to. Fantastic. Chris, PCFA?
Yeah, look, I agree with everything James has just said. It's trying times. It's unprecedented challenges that we've had due to COVID. But, you know, there's a lot of risks that are not new either. It's just been highlighted given COVID situation and everybody being affected by isolation, etc. So look, I think coronavirus recovery is an opportunity to set the stage for some more inclusive, equitable, age-friendly, male-friendly society, I think.
Wonderful. Thanks, Chris. Wonderful to have both you and PCFA represented here today. Look forward to seeing you face-to-face again sometime soon.
Well, and no doubt fly out of Queensland.
Yeah, when we can. Yeah, well, I'm in Queensland, so theoretically I can come and see you. But yeah. And then last but not least, Louise at Tomnet.
And again, I think being the last one, as always, as I said, I think it's all been discussed. But I think there's such COVID-19 has presented so many opportunities while it's had such a large impact. And I think we should harness those opportunities. And it's just given us such a great opportunity to come across solutions to things that we perhaps never had thought of if we hadn't been pushed into it. So there are some positives to go forward with.
Great. Thank you all. It's been a wonderful discussion, and it will continue.